right from the beginning of training, have the end of training in mind. I see a lot of our IMG friends and even non-IMGs who are just focused on getting through GP training. Times are really hard right now, but start early. Get the contact details of the surgeries around you.
My guest today is Dr. Ola, a GP who is also a TPD and has been helping the IMGs community. Hi, Dr. Ola, how are you doing?
Fine, thank you. Hi, thanks for having me on your show.
For people who might not know you, give us a little bit of background, how you got in GP and your story.
Coming from Nigeria, my background is in pediatrics. Then I came to the UK and I was in A&E. And at the time I was contemplating going into A&E training, but I saw that the hours are not what I wanted. And working in A&E, my sleep got significantly affected. And so I thought, why not just go back to the pediatrics that you're so good at? And then I realized the same thing applied to the pediatric consultant as well. So I said, you know what is it that will give me that continuity of care, that will give me the opportunity to see those whom I've seen before, where I can always follow things up at the same time, not working at 12 midnight or at weekend, except I choose to do so. So I said, you know what, I'm going into general practice. So I applied, I got it in Coventry, and I CCT'd 2 years ago in Coventry.
So could you tell us about your experience of GP training? How did it go for you?
Well, GP training, I really loved it. But the thing about training is that the fact that we are training doesn't mean the rest of our lives pause. The significant events that happen in our lives, they continue as we train. And we know that these events can have significant effects on the training. For instance, in my own case, I got married during training. I had a baby towards the end of RCA. So those were the twists in the training. But by and large, it was a good training. I felt very supported, and which is why I stayed behind.
It sounds like you had a positive experience despite the challenges. Then you went on to become a TPD. How did you decide that you wanted to be a TPD?
Even before going into training, I've always been in medical education. I started by teaching the MSc nursing class, which was a volunteer role. Then I went into teaching the medical student, again, volunteer role. Then I volunteered to be an examiner with the RCP, the Royal College of Physicians, PA faculty, again, a volunteer role. Then I was an examiner in medical school. For medical school in my region, again, a volunteer role. So what all this helped me to do was to gather all the capacity, gather all the knowledge, gather all the skills I needed, because I knew I was going to go into medical education. I've always loved it. I've always found joy in teaching. I've always loved helping other people, impacting knowledge. So I knew I was going to do that, and I've been working towards it right from day one. So when the vacancy came out, which was only just 6 months after I CCT'd, I threw my hat in the net, and then I had the interview, and that was it. And since then, I've not looked back.
For people who are watching this, can you see the experience that Dr. Ola had gathered over years in medical education? So it's really important to get into it, even if it's volunteering to begin with. Then when the opportunity presents itself, then you seize the opportunity. So tell us about how would you think about your career then when you make this decision about choosing roles in your career?
The thing that dictated my choice really is the fact that I wanted flexibility. I didn't want to just do the clinical part alone. I mean, I absolutely love the clinical part. I love seeing my patients. I look forward to it every blessed day. I feel blessed to be able to do that. But the fact that I could do something else, it just feels like I'm enjoying myself. It doesn't feel like I'm working. And then it just breaks that structure. It breaks my week into two different halves. And I just like it. So it's that flexibility first and foremost. Secondly, I was a bit worried. CCTing, I was hearing stories about burnout. I was hearing all sorts of stories. And I felt, how do I make sure I do not burn out? And it's one of the decisions I made that, you know what, you love teaching, you enjoy it, go do what you enjoy doing. As you help patients, teach on the side as well. And it's been an absolute joy for me.
It's very important to find the sweet spots and knowing what exactly passionate you. And when you do it, as you say, it doesn't feel like work. And in terms of your roles as a portfolio doctor, tell us more about what other roles you've got.
I work with England Boxing as a ringside doctor, which is a volunteer role. Growing up, I loved boxing. But when you grow up in an African household, you cannot tell your mom that you want to do boxing. You cannot do that. So when I was then working in A&E and the opportunity presented itself to go into boxing, it's something I've always loved. It's a sport I've always found fascinating. So I grabbed it, did the training, and now I travel all over the country supporting amateur boxers under the auspices of England Boxing. One thing that really made me like boxing is the fact that I see it as a very important tool for social change. I've seen a lot of young boys and girls who were involved in drugs, involved in knife crimes, and the moment they come into boxing, given a sense of purpose, within a year, they're completely different. You will struggle to identify the same person you had seen a year ago who was unruly, who wouldn't follow the rules, and within a year, they are different people. So, and it's taking a lot of people, young people, away from the streets and giving them a sense of purpose, giving them a sense of something they are doing, keeping them busy. And once they are kept busy, they are not doing vices, they are not doing drugs, they are not doing gangs, they are not doing knife crimes. So for me, that's by far the most important reason why I keep doing boxing.
Let's talk about the pros and cons of a portfolio carrier then. A lot of good things are said about portfolio carrier, and you mentioned the benefit of flexibility. Tell us a little bit more, as in somebody who is thinking of developing a portfolio carrier. What should they know?
In terms of what they should do, first and foremost, they should decide what is it they enjoy doing. Let it be what they love doing. And once they decide that, they should send out the word early. I remember in my early days in the UK, one of the first things I did was to go to the medical education department and say, look, I love medical education, but I don't know what to do. And the director looked at me and he was like, you know, I like you. And I was there thinking, what does it mean? What did it mean by saying that? And within a couple of months, I got an email saying the MSc nursing class needed to be taught. Their lecturer had taken ill, that do I want to volunteer? And that was it for me. So that's the first thing. Send the word out early. Second thing is that there are going to be setbacks. There are going to be setbacks. I've applied for several roles, and there, Ola, unfortunately, once you say unfortunately, and I'm like, you know what? I'm not even asking you to pay me. I'm asking to volunteer my time and my expertise to teach you, and you're still rejecting me. So you're going to be rejected. If you want it enough, keep pressing.
Are you feeling unsure about the SCA? Maybe you don't know what to do, or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA Blueprint, click the link down in the description below to get access to the SCA Blueprint that GP trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it.
Finally, is that capacity building. You cannot give what you do not have. So, I mean, it's just like taking someone from the street right now who is not a doctor, who haven't been through GP training, and asking them to be a GP. So there is a process of training involved with it as well. So we need to go through that process. And finally, especially for my IMG friends, is don't think of the money. If you do it well, the opportunities will come as a consequence of doing it well.
The money thing here is one of the trap when you're thinking short term. then in the long term, you've got a job that you don't enjoy doing. Whereas if you do it the other way around, when you enjoy doing it, even if you're not getting paid, then when you're getting paid to do it, it will be like a bonus because you'd be happy to do it without being paid as well.
Absolutely. And in terms of the cons of it, so apart from that flexibility, people who do other things tend to last long in the career. They tend to last long in the career, and there is this satisfaction you've got that, you know what, yes, I'm a doctor, I enjoy doing it, but at the same time, I'm also doing what I wanted to do from as a child. That thing that I couldn't do, I'm now doing it. In my case, boxing, in my case, teaching. So that satisfaction that comes with it is also there. I can't really think of many disadvantages, to be honest. The only thing is that that temptation sometimes may be there at some point to leave your primary clinical role. So especially, you know, one can get carried away if one isn't careful. And what I always say to people is, look, first and foremost, you are a doctor. First and foremost, you are a GP. And I tell myself that every day, that look, your role as a TPD is a consequence of you being a doctor first. Your role as a ringside doctor is a consequence of you being a doctor first. Be a solid one. Be a good one at it. And when you are a solid one as a doctor, as a GP, then it will spread on to other things.
That's very important to remind ourselves. The thing is, sometimes when you're developing a portfolio career, there are so many opportunities, and you find yourself doing too many things and then not doing what you're supposed to be doing very well. So you're spreading yourself too thin. Let's talk about job application for a newly qualified GP or somebody who's finishing training. We know how difficult it is now to get job, and what advice would you give to the younger generation and early stage career GPs?
First and foremost, my advice is right from the beginning of training, have the end of training in mind. I see a lot of our IMG friends and even non-IMGs who are just focused on getting through GP training. There is life outside of GP training. Prepare for that now. Be part of that team. Don't go to the team only to pass your AKT and pass your SCA, and that is it. No. So that will be my first advice. Second is to start early. Yes, times are really hard right now, but start early. Send the word out early. Get the contact details of the surgeries around you. Start early. And the third is a bit of flexibility. There are areas that are struggling, but at the same time, there are areas that are not. So, and my advice is, when possible, be ready to move as well to those areas that are not. And finally, it comes in cycles. Speaking with very senior colleagues who have been GPs for years, and one thing they all tell me is that, look, Ola, this has happened before. We've been here before. So it will come and go. It will not last forever. It will come and go. And when it goes, it is those of us who have been strong that will remain in it.
There's some solid advice here. Working on yourself is really important. There are jobs that you might need to compete with other people. However, if you have developed that relationship, connection, and people in your area know you, that you're reliable, that you're competent, then the opportunities are going to present to you.
Absolutely. In fact, every single job I've got is because is from word of mouth. For instance, my GP role, I stayed in my training role, and so if I had been a bad trainee, for instance, if I've been a troublesome one, if they couldn't trust me, they won't ask me to stay on. So it's important to build that network, build a strong contact base, have good contact on your phone, but let people have solid, good things to say about you as well.
Absolutely. And I can see that the more GP is going into content creation, and I know that you also do some videos on YouTube. Tell us more about that endeavor.
So towards the end of my training year, I realized that IMGs were struggling with the RCA a lot. So one of the things I started doing was to coach people for the RCA. And before I knew what was happening, I was getting calls from all over the country. And And some days I could answer the same questions 3, 4, 5 times. While I try, to help as much as I can, I felt there is no point answering the same questions 5, 6, 7 times every day. Why not record the top queries people have, put them in the channel such that there is somewhere to signpost people to? If they then have further queries after that, then I will be more than happy to answer. And also to encourage people to be the one driving the channel as well. I want to know what people want to listen to, what people want to watch, what people want to learn. So, and what I have noticed that has done is that it has reduced the number of people contacting me. It has reduced the number of queries I have to ask because they are on there on the channel. So still very early days, still learning how to do the videos and all, but I've enjoyed every bit of it so far.
It's really useful, YouTube as a platform to learn. What would you say are the common pitfalls that you've seen among trainees who are experiencing difficulty in their journey?
The thing I see, especially with IMG training, is that not actually settling, not settling into the environment. And because when one doesn't settle, one struggles with everything. And many still see things from the lenses of where they're coming from. And this is not a judgment on which is better or which isn't. It is about, now I'm in a new place. I need to then integrate into the society to know exactly what people are saying, even when they're not saying it. What people mean, even when they've not said it, when they've implied it. And it does take a level of being integrated into the society to understand that. So that's, I think, is still by far the commonest problem. Second is the fact that, it's not an easy thing, to be honest, coming from another country, leaving your loved ones, your language, your food, your weather, your everything. It takes a lot of guts, and every day when I see IMGs who are doing it, my respect for them doubles, because I've been through it. It is significant. It is significantly difficult. It is very difficult. So, my word to IMGs is always that, look, you've done the difficult part. You've come in here, you've left everything you know, everyone you know, all your food, all your friends, all your loved ones. You've come in here. The remaining, it's not as difficult as the part of it you've done already.
It's really good to highlight the sacrifices and the resilience of IMG's doctors coming into the UK and working. And yeah, that integration can be very difficult. And this is what I've found, having other friends and making these connections really help, because then you can get to learn the language and the culture. And this is going to help you in your career here.
Absolutely. And the other thing that I see helps a lot is having friends, having those allies, either who have been through what you've been through, or even if they've not been through it, but they've supported you. I've been blessed to have significant support in my practice, significant support in my role as TPD, and that has played a huge role. And so it's important to seek out people who will be available to contact when the going gets tough.
If you're a GP trainee who is a little bit uncertain right now about your career prospect, make sure that you reach out to other people who might have been in the same situation as you a few years ago, and they'd be more than happy to help you out if you ask for that help. So I think it's a good place to finish here. Have you got any last word that you'd want to say that I haven't asked you about?
My last word will be, you've been through medical school. You've passed many exams in medical school. You have faced many problems. You have subdued them all to get to this stage. You've subdued them all. So what's in front of you will be no different. It will be no different. It will come and it will go.
Thank you very much for watching this video up until the end. If you found this video useful, you might want to watch the next video here.